Good morning, students. Myself, I am Dr. Indira, dealing the course Probiotics and Functional Foods. So we are in Module 1, Unit 2. Today we'll see the topic that is probiotics and prebiotics in the treatment of hepatic encephalopathy. What is hepatic encephalopathy? Hepatic encephalopathy is nothing but the accumulation of toxins in the brain. That is called hepatic encephalopathy. How these toxins accumulated in the brain means generally this occurs because of the chronic liver disease. So this chronic liver disease is nothing but sometimes the hepatitis and then cirrhosis. So they trigger because of the dehydration or infection. Okay, so here, because of this one, the accumulation of ammonia levels will be increased. So accumulation of gut-derived toxic substances such as ammonia in the bloodstream and that are normally removed by the liver. This is the normal function. But here, the liver is infected with hepatitis and cirrhosis. Liver is affected with hepatitis and cirrhosis. So the symptoms for this hepatic encephalopathy are forgetfulness, confusion, and if your breath has a sweet or musty odor. And once the symptoms are advanced, it leads to shaking of the hands, arms, slurred speech, seizures, and even disorientation. So these are the symptoms of the hepatic encephalopathy. And here you can see the dysbiosis and liver cirrhosis. In such cases, the accumulation of the ammonia levels will be increased in the bloodstream. So this is called hyperammonemia. So because of this, the brain got affected and the functioning of the brain will be seized, and due to this, hepatic encephalopathy will occur. So generally, the treatment is the purgative ammonia lowering therapy such as disaccharide lactulose and non-absorbable antibiotics. These are generally prescribed. Apart from this, combination of probiotic and prebiotic, this is an effective alternative treatment with the lactulose. And not only this one, another probiotic strains like Bifidobacterium and fructooligosaccharides, they decrease the serum levels of ammonia and improves the mental function. And here another no adverse effects were observed with Bifidobacterium and fructooligosaccharides groups, but occasional abdominal pain, cramping, diarrhea, and flatulence were seen in the lactulose group. And Bifidobacterium and fructooligosaccharides, they impact the cognitive abnormalities of the hepatic encephalopathy. So the treatment with Bifidobacterium and fructooligosaccharides is an alternative to the use of lactulose in patients with the cirrhosis. Based on the patient condition, we need to design the probiotics and prebiotics. Generally, these probiotics and prebiotics, how do they work in the hepatic encephalopathy case? They help treat the hepatic encephalopathy by altering the gut flora and decreasing ammonia production. So this improve the nutritional status of the gut epithelium, which leads to decreased inflammation and oxidative stress in the hepatocyte. So if you see the effectiveness, they reversing the MHE in 35 to 60% of patients and prevent the recurrence of hepatic encephalopathy. They improve the quality of life and plasma ammonia concentration. Comparison to other treatments, this probiotics and prebiotics, they are effective alternative to lactulose, a disaccharide, generally used for hepatic encephalopathy. So apart from lactulose, these prebiotics and probiotics, they are effective. And still challenges are there to using microbiome therapeutics to treat hepatic encephalopathy. There is the microbiome resilience to change and unpredictable clinical outcomes. Here, see, we can observe the ammonia levels will be increased. It affects the neurotransmitter modulation, reduction of oxidative stress, increases synthesis of the glutamine, and urinary excretion of phenylacetyl glutamine, and alteration of enteric bacterial flora, fecal microbiota transplantation, probiotics, sulfaxin, and nitazoxanide. These are the treatment or therapy for hepatic encephalopathy. And decreased intestinal ammonia production and absorption by using lactulose and lactol, polyethylene glycol, rifaximin, nitazoxanide, ST120, and probiotics. And increased urea production is there. In such cases, L-ornithine, L-aspartate, acetyl L-carnitine, and zinc. These are the remedy. And neurotransmitter modulation, flumazenil, acetyl carnitine, and galaxolol. So these are the various drugs and then treatments used for treating the hepatic encephalopathy. So the probiotics, bifidobacterium and lactobacillus species, they improve gut barrier function and reduces the systemic inflammation, thereby reducing the blood ammonia levels and alleviating the cognitive symptoms. And prebiotics like lactulose, they promote the growth of beneficial bacteria, reducing the toxin absorption. So this approach aligns with the growing emphasis on gut-liver-brain axis modulation in hepatic encephalopathy treatment strategies. Thank you all.